Welcome to the Fracture Prevention Central webinar, NBHA's one-on-one free FLS consulting service launch. Fracture Prevention Central, brought to you by the National Bone Health Alliance, is made possible through the support from Amgen, Inc. and Eli Lilly and Company, Inc. I'll now introduce you to David Lee, Executive Director for the National Bone Health Alliance.
Thanks so much, and good afternoon, everyone. I guess some folks aren't quite at afternoon, but really pleased to have everyone on the line today to talk about the new Fracture Liaison Service one-on-one consult service that we're launching. We'll talk more about what we've done to date, really what you need to do to be able to get this help and support that you need, which we've really heard from folks is, I think, the next phase in the kinds of resources and support that we want to give to you and that we're hearing from folks is critically needed as they move their Fracture Liaison Service program forward. So just to start out, a quick NBHA overview. We've been around since late 2010, actually celebrating our 5th anniversary this fall as a public-private partnership that brings together all the sectors, the public, private, and nonprofit sectors. We currently have 53 organizations around the table, 29 nonprofits, 19 private sector members, and 5 government liaisons from CDC, CMS, FDA, NASA, and NIH. Our collective reach through the entire membership is over 100,000 healthcare professionals and 10 million consumers. And really our job is to address the priorities identified in the Bone Health Summit National Action Plan, which is to promote bone health and prevent disease, improve diagnosis and treatment, and enhance research, surveillance, and evaluation. So NBHA uses its voice and membership to weigh in on subjects such as vitamin D and calcium, bone density testing, benefits and risks of therapy, really, looking to be able to use the group as a communications platform for bone health. So really pleased to see how much we've been able to accomplish in the last 5 years, as you can see in this snapshot. The items in orange being the Fracture Liaison Service work that we've been moving forward since our inception in late 2010. So NBHA's vision is to reduce bone breaks 20% by the year 2020. So really everything we do relates to that, and I'm sure many of the folks know these statistics, but just to level set, we have over 54 of the 99 million folks age 50 and above that are at risk of suffering from a fracture, having either low bone mass or osteoporosis, which represents 17% of the entire U.S. population as of 2010. Projections are that figure will go up another 27% collectively in terms of folks that have either osteoporosis or low bone mass between 2010 and 2030. So obviously with the aging of the population, we really need to do work like this Fracture Liaison Service care coordination to really address the issue, because it's just based on the demographics, it's the number of folks that have osteoporotic breaks and have osteoporosis or low bone mass will continue. So just a few of the major statistics. About 50% of women and up to 25% of men will break a bone due to osteoporosis in their lifetime. We've got about an 80% care gap in terms of folks, once they've broken a bone, getting either tested and are treated. So only about somewhere between 25 and 30%. Right now we're getting that, so that's a obviously very significant care gap. We've got half the folks that break a hip ending up in nursing homes, 25%, and half never regaining their previous function, costing us right now about $17 billion in healthcare dollars per year, projected to go up to $25 billion by the year 2025. And here's just kind of as you compare osteoporosis with some of the other major, especially chronic diseases and conditions. So this is data from the 2013 HEDIS HMO population. So you can see our testing and treatment after a fracture, 29% currently, which is a little bit better than, it has increased slightly over the last few years, which is great to see it moving in the right direction. But when you start to look at some of the other diseases and how much farther ahead, honestly, they are, the one that I like to really focus on in a comparison is I guess the third from the bottom, beta blockers after a heart attack. So to me, that's secondary prevention in the cardiac space, which is very akin to the secondary prevention that we're focused on after a fracture. So to think that they're nearly tripled our rate of adherence around that quality measure just really shows we have a long way to go. So really pleased to have so many folks involved in the efforts to get fracture liaison service programs going here in the States. So, really the international consensus is that FLS is the model we think is really the solution to this care and treatment gap. Just to level set, once again, an FLS model, also the fracture liaison, known as the fracture liaison service, is a coordinated preventive care model which operates under the supervision of bone health specialists and collaborates with the patient's PCP. Really make sure that patient, once they have had that break, instead of many times is what's typically happening in the U.S. and around the world today, really losing those folks after they've gotten the break healed, either through casting if it's a more simple break, or surgery if it's a more complicated break like a hip. Really losing those folks in the process once that happens. So this model's been running for over 15 years around the world. We have great data on how it is effective in not only improving patient outcomes, but also driving healthcare cost savings. And then this is just a little graphic of kind of the coordination and action with this FLS coordinator kind of in the center, in the quarterback of this care team, and then really working with primary care, other medical specialists, orthopedics, nursing, physical therapy, nutrition, and the hospital emergency department as necessary to make sure that all of those dots are connected for the patient. So one of the things that we have done here at NBHA is launch the Fracture Prevention Central Resource Center on FLS. I guess it's been about 2.5 years that it's been up and utilized by lots of folks. We're getting really close to having 3,000 folks registered for accessing the tool. So really pleased to see that there's a lot of demand, of course, for folks wanting to learn more about the fracture liaison model, how you do it, what stakeholders do you need, and I think we've been able to offer a lot of new resources and support for folks to be able to do that work. So this is just a screenshot of the site, which we have revised fairly recently a little bit to make it a little more navigation friendly, and would love to hear your thoughts and feedback on any other remaining tweaks we might need. So please feel free to pop us an email and let us know if there are other ideas you have moving forward. But really pleased to be able to formally announce today and launch the newest piece of the puzzle as it relates to Fracture Prevention Central and NBHA's FLS work, which is a one-on-one consult service that is available to users at no cost, made possible by support from Amgen, which is going to allow folks to connect directly with FLS experts. So, what we've been hearing from a lot of folks is that, the resources and tools up on Fracture Prevention Central is great, the archived webinars, all the other pieces, but I still need that one-on-one brainstorming around, whatever barrier I might be hitting, if it's, implementation itself, if it's understanding the reimbursement landscape, how do we identify these patients, the business case around FLS, whatever that sticking point is for you, to be able to connect you directly with experts that have, dealt with that in their own institution, in many cases have helped additional institutions figure some of these pieces out. So, really pleased to be able to now launch this formally today. And you can actually go up on the Fracture Prevention Central website right now. You can see the mechanism that I'll go through in a minute to get in the queue to be able to connect with these folks. So the service did debut kind of the soft launch in May during the National Osteoporosis Foundation Interdisciplinary Symposium on Osteoporosis. And we were actually able to meet one-on-one with about 60 folks during the 3 days of that meeting. So we were able to schedule 45 to 60-minute one-on-one sessions. We had about a dozen FLS experts that were helping us connect with these folks. So, really great to be able to kind of debut the service face-to-face, but now we're ready to kind of launch it. The virtual version, which would be either, a teleconference, webinar, if there was, data to share back and forth. So that's kind of the mechanism we see this moving forward. So just, kind of the step-by-step instructions on how to get this arranged for you. First thing, you will need a free Fracture Prevention Central account, which is, you can see if you don't have an account, there's a very clear sign-up link right on fracturepreventioncentral.org. You would then need to click from the front page carousel on the link to the one-on-one consult page. There's a short online request form that we ask you to fill out, and that really is, going to be able to help us triage you to the right expert. Obviously different skill set for the specific reimbursement questions than for patient identification or the business case. So we just want to make sure that we can get you to the right or best individual to answer your questions. So once the form is submitted, you'll hear from us within 3 business days, and we'll work with you and the experts to arrange a telephonic consultation time. And we'll also send you a listing of resources related to your question that is already present on Fracture Prevention Central. And I guess the one thing we do ask is that before you ask for the consulting help, that you make sure that you've kind of scoured the Fracture Prevention Central site and have a basic knowledge of the FLS program or very specific questions on kind of your piece, because obviously there's a lot to cover. So we just want to make sure that folks are able to go through that before we connect you live to an expert. So we'll get that call set up, and then actually after the consult is completed, we'll send you a post-consult survey asking you to assess the feedback on the program, how the expert was able to help, if there are other suggestions or questions you might want to suggest to help us improve this program. So that essentially is kind of the steps to take to be able to get this next piece. Additionally, we are going to the next chance to do this on an in-person basis will be during the American Society for Bone and Mineral Research meeting. We'll be having times on October 9 and 10 in Seattle, Washington during the ASBMR annual meeting. And we'll certainly have a mechanism closer to that meeting to be able to get your specific time slot scheduled in advance. But in the meantime, if you want to email Debbie Zeldo at the email address here, debbie.zeldo@nbha.org, we can make sure that you're in the queue and can get you arranged that one-on-one time in person in a few months. But certainly, wanting folks now to be able to utilize this new service that we're officially launching today to be able to do it, kind of the telephonic version. And then just a few words about some upcoming webinars for the rest of the year, some of the major topics that we've really been hearing from folks that are things that they are, feel like a webinar collectively to the group here would help. So some of the things we're talking about, and you can see how it's laid out from August to December. The next 5 webinars through the end of 2015 include a focus on FPC tools, materials, and resources to build your program, a case study on patient identification, which I know is a big challenge for some folks, especially for instances in which some folks that are on electronic medical records that the inpatient, outpatient are different, being able to figure out how that data flows and how you can identify patients that may come in the emergency department that you may not have access to the EMR to connect through to. October, we'll also have a webinar on this current year's Osteoporosis Qualified Clinical Data Registry, which should be up in the next 4 to 6 weeks. We're working hard to get the 2015 version up, and the good news is that we have a lot more measures that are part of this year's QCDR, and eager to be able to take you all through that as well as you consider making sure that you're participating in Physician Quality Reporting System program. And in November, we'll be talking about measuring the impact of your FLS program. and then December will be really focused on the business case, selling the FLS to the C-suite. So that's how the webinars lay out the rest of the year. Really very brief presentation today. I hope folks have questions. And let me turn it back over to my moderator, and she can prompt you on how to best ask a question, which can be either online or telephonic.
Thank you so much. And to ask a question via the web presentation, select the chat pod located in the lower left corner of your screen, and then type and send your question. If you wish to ask a question live via the phone, press *1 on your telephone keypad. I will announce each caller prior to bringing you into the conference. Please remember, if you have your phone on mute, take it off mute when you are selected to ask your question. Once again, to ask a question via the web presentation, select the chat pod located in the lower left corner of your screen and type and send your question. And to ask a live question, press *1 on your telephone keypad. And we'll pause for just a moment while we assemble any questions. Thank you. We do have one question that has come in chatted. At the moment, we do not have any live questions.
Yeah, so let me take the first one. The first question, how do we incorporate the FLS system into current management for into current practice for management of osteoporosis? I would say some of that is covered within the Fracture Prevention Central website, essentially how at least the folks that I've spoken to really integrated. I mean, obviously, FLS is a piece of that puzzle, but is not focused on primary prevention, certainly, and at least until you're kind of further down on that pyramid. I think many of you may have seen that really starts with the focus on either just the hip fracture patients or hip and other fragility fracture patients as the first step as you start a program. But then, as you really rest the results from that piece, then usually adding folks that are at high risk for first fracture and ultimately to all older patients. In the case of a Kaiser that's been running their FLS program for about 15 years. In terms of starting at the folks that will give, that are telling you because they've had a fracture already that they most likely have the underlying disease. So to me, in terms of how you integrate that, is FLS is a piece of that puzzle, and certainly you'll want to be identifying folks at risk through secondary causes of osteoporosis that may already be at high risk for having low bone mass or osteoporosis. So hopefully that answered that question. See a few other questions as well. Just a question whether this and future webinars will be available on demand. Yes, indeed. Actually, all of the webinars are available on demand. And we also have a fairly new YouTube channel that has all of the webinars available kind of on one page. So we have a couple of different mechanisms to get at that. So actually, if you go on the website and find the webinars page, there's both a link to each individual webinar and then also a link to the YouTube channel. And see a few other questions here. A question about whether NBHA has a registry similar to Own the Bone. So NBHA was part of a pilot project that essentially took the FLS model of care, electronicized it into a number of care coordination, quality improvement tools, as well as really almost mapped out the model in a registry. That's something that now we're actually at the end of the pilot phase. We had 3 pilot sites that were utilizing the tools, and we're actually in the process of writing up the final results. And just to say, the results are great. Can't wait to get the data out there in the community. But no, we were able to very quickly get those folks that did not at that point before the pilot have an active FLS program to really getting set up very quickly, moving the bar on, DEXA treatments, non-prescription medication use. So that's something that is now being marketed through a joint venture called Ostonix Quality Solutions. So that's something that NBHA is no longer involved in now that the pilot is done, and we kind of tested the feasibility, and that is now being offered to the private sector through Ostonix. Let's see, I have another question here. Will it be possible to have each of the webinars taped for future use, and will they all be at the same time? So yeah, I know it's a challenge because I see this person is actually from Hawaii, so that's a big span of time from East Coast to Hawaii time to try to accommodate, and actually that's why we have all the webinars available on demand. Knowing also that folks with higher level of clinical duty sometimes doesn't have much of any window during the day to participate in webinars. I mean, certainly would love some feedback on, or maybe we can look at ways that we might be able to move around the times a little bit to make it a little more friendly. But we do try to do typically around the lunch hour East Coast time, which obviously is maybe 9-10 a.m. Pacific time, which when you go to Hawaii, I guess is before the workday starts. But and part of it's based on the individual speakers as well and their schedule. Okay, a couple more questions here. Do you need to use an endocrinologist to see the patient or just the fracture liaison? So really it depends on who sits in that care coordinator, FLS coordinator position. So I know, for instance, that in the Kaiser system, most of those folks are nurse practitioners, and obviously they're able to order DEXAs, prescribe medication, et cetera. But for programs that the FLS coordinator does not have that level of ability to do some of those pieces, then that some of that burden then falls a little bit more on the physician, being an endo room or orthopod. So it just really depends on kind of who you have in that position and what they're able to do and not do. Let's see. All right, so this is another question. The business plan resources are currently not available. Yeah, I know for some reason folks have been having troubles accessing those files, and we're still kind of troubleshooting why that's the case, because we're able to access it here. I would say probably the best thing to do, and you can see our email addresses up here, if there's anyone specifically that wants those pieces while they're, for whatever reason, not, some folks are having troubles accessing them, just email me directly, and I'll make sure to email that right back to you. Let's see, another question, is there a workflow management tool? So there are a couple of pieces up on Fracture Prevention Central that speak to workflow management and kind of really the major touch points of the FLS program. So I would refer you to that, and I believe it's under the resources section, and I know we have a couple of nice Kaiser pieces as well, if you go to the Kaiser case study that has some of that workflow. Let's see, another question. The documents that are available on the FLS website, can they be reprinted or rebranded for your own organization? Yeah, I know that Kaiser has expressed to us that they are comfortable, happy for folks to rebrand the pieces that they've been able to share on our website. I mean, I would say probably the best thing for us to do, just to be sure that is the case, if you want to connect with us, and we'll make sure that we can connect you directly to the Kaiser folks to get that, that would be great. That would be great. Let's see, next question. Why is selling to the C-suite last instead of first in your timeline? I think it really was based on the expertise that we were able to identify, but we can certainly look at those, because obviously that is a big piece of the puzzle. I guess just another related thing in terms of what we're working on the NBHA side related to the business case is, and I think we've talked about this before, and it's just unfortunately taking a little longer than we would have anticipated, is we're working with the Research Triangle Institute to create a reimbursement calculator that essentially would help you both in the here and now as well as looking forward as healthcare reform continues to move forward. Essentially you'd be able to put in your, we had 50 hips, 200 femur last year, et cetera, enter in kind of your data, and it would kind of help you do that reimbursement math, knowing that in the current reimbursement system, it probably is break even at best, depending on what setting you're in, certainly. But then, moving forward as, in a few years when healthcare reform is fully implemented and, you're going to actually get dinged financially if, for instance, a patient that fractured 18 months ago comes back in for another fracture, you're going to get dinged for missing that underlying disease from the first go around. So we know that the financial picture is going to look different in a few years, and we're kind of evolving to that. But really, the goal, of course, is to be able to, give that ammunition for you back to the business folks to be able to say, I know it's not gangbusters financially right now, but it isn't like we're going to be able to turn this on in 18 months. We need to build a program so that once we have a little bit better financial picture, we'll be able to offer these services. Let's see. I see. It looks like a couple more questions, and I may not get to them all. I'm glad to see how many questions are coming through this, so thank you. Let's see. I currently see patients for bone health and wish to expand to other clinics. We don't have an EMR yet, but we'll be getting something else. I'm worried about keeping up to date with my records. What data collection system is best? So I would say, the beauty of the tools that we piloted that are now being sold by Ostonics Quality Solutions is that it's, because it lives in the cloud, it's EMR agnostic, so you don't have to have a certain EMR system. Obviously there's some kind of data entry involved in that, putting in a patient's demographics, but then the great thing is that once that first kind of interaction is put into the system, the next 10, 12 touches per the FLS protocol are all populated, and, once you're able to see, once you have a couple hundred patients, let's say, in your program, you're going to be able to almost see your to-do list on a weekly basis. So, the 40 things you need to do for your 50 patients that next week. So I think that's the beautiful part of really being able to electronicize this model into a number of clinical decision-making tools. So let's see, next question. Just a question about sending information on the registry. So I guess the best place to go is if you just go to www.ostonics.com, I got to get this right, ostonics.com. There's information about the registry and tools that are being sold by that group. And then actually just an update that we, as we said, the webinars are all on the YouTube page, and maybe what we can do too is make sure that we push out that specific link. Of course, it's a really long link. And let's see, next question. Let's see. Oh, this is one I probably cannot answer, but are any sites administering injections while patients are still IP? Yeah, that's one I don't think I'm going to be able to address. And actually, it looks like we're pretty much at stop time. So I hope that I was able to answer some of those specific questions. Certainly, you can see our contact information up if you'd like to follow up directly with myself, Debbie, or Andrea. And I really appreciate your time and really hope to get lots of folks involved and using this new consult service, which we're really excited about. Thanks so much and have a great day.
Thank you. Have a great day.